Good morning, everyone. Welcome to our virtual Men's Aesthetic and Wellness event sponsored by Amachi Spa and Georgia Plastic. This events will also co-sponsored by our newest center, the Ageless Men's Center at Georgia Plastic. Our goal is to enhance your confidence, vitality, and performance. This is brought to you by the team at Georgia Plastic. Today is Saturday, June 28, 2025. I'm going to be your host. As you guys know, Georgia Plastic, we do surgical and non-surgical enhancement. Amachi Mespa does only non-surgical procedures that enrich your life as well. The objective of this event is to empower men to feel and look their best with safe, modern aesthetics and wellness solutions. On today's topic, we're going to talk about the following: Botox, erectile dysfunction and male enhancement, gynecomastia or man's boobs, body contouring, both surgical and non-surgical, weight loss solutions, hair restoration with smart grafts, and how to pay for it. And at the end, there'll be some question and answers. So without further ado, I'm going to kick it off with Botox. So what is Botox? A lot of my friends said, well, you don't age, you still look the same. I said, yeah. So I get my Botox every 3 or 4 months. I want to look good. The common areas are usually the forehead, kind of shows the early signs of aging, and you want to look your best and feel your best. When you look good, you feel good. So there's no downtime. Every 3 to 4 months, I get it done, and many people do it. These are some pictures from Botox. People that men that it gives you that younger, healthy look instead of the angry look. Some people think you're angry, and I make videos of myself doing Botox. So I get mine every 3 months, so it's very specific for me. So let's talk about the next thing. It will be erectile dysfunction. Erectile dysfunction, also known as impotence, is defined as a sexual dysfunction by the inability to initiate or maintain firm erection. It's the incidence of the prevalence of ED increase with age. At between age 20 and age 40, 5% of men have it. By the time you get to age 50, about 50% of men will have it. And 70 years old, about 70% of men would have it. And many people don't know what causes, and then there's so many treatments. So the most common cause of erectile dysfunction has three primary causes of physical causes, because 40% are psychological condition. But the 60%, we can have diabetes, vascular disease, people that have prostate surgery, spinal cord injury, endocrine, or multiple sclerosis. When you break those things down, many of these will lead to vascular problem. Vascular ED is when you don't have enough blood vessels taking blood to the pili tissue. And this is the most common cause of ED, and that's what we want to treat, the most common cause of anything. Other causes are neurogenic, hormonal, or psychogenic causes. I just want to kind of talk about the anatomy of the penis. The main two functions is for reproduction and urination. Has have three major parts: the base, the shaft, and the glands. In the shaft, there's two main chambers called the corpus cavernous. So that's where the blood flow goes, and that's what gives erection. Essentially, the arteries are in the cavernous. When we have good blood flow, it enlarges and it compresses the vein, so the vein doesn't take the blood out. Essentially, erection is the ratio of blood that's going in and the ratio of blood that's going out. The common treatments of ED that's out there right now is there's so many over-the-counter medication. Most of them don't work. There's prescription medicine. Everybody's familiar with Viagra, Cialis, and other ones. They do work, but the problem is they also have other side effects. These are these can lower your blood pressure. I'm sure you've heard about people having heart attack after taking those things because it can lower your blood pressure significantly. There's devices that require that work. Like the shock wave therapy helps to improve blood flow. Again, blood flow is a problem, but it doesn't do it very well. There's surgical procedures, implants, and of course, there's always risk of surgery, but those also has their own issues as well. So I want to introduce Apex. Apex is a fast and effective bipolar radiofrequency energy that basically what it does is it stimulates the tissue, the in the peanut tissue to stimulate blood flow, and I will show you how that works. This is an in-office, non-surgical, pain-free procedure that requires no downtime. The basic science of this is radio frequency energy creates heating of this tissue, the corpus cavernosum. I think it's called angiogenesis. Angiogenesis is when your body makes new blood flow. Part of the problem with erectile dysfunction is there's not enough blood flow to the tissue. So if you have something that can increase the blood vessels, arteries that bring more blood to the tissue, then you solve the problem. So that's what Apex does. The other thing it does is it stimulates the body to make more collagen. The collagen strengthens the tissue, and it has a side effect that it can actually grow the width of the penis, which is called the gut. But that's not the main reason why we're doing it. So when that's done, the effect is you have a robust peanut tissue and that has a good blood flow to it. So the patient is happy. Of course, to do all of this stuff, consultation is required. On that note, we will take questions at the end. I'm going to introduce the next section will be Dr. Greg Lee, who is going to talk about um, male enhancement and gynecomastia. Dr. Lee,
All
ready?
right, thank you so much. It's such an honor to talk about topics that I'm very passionate about. Women it's very common that it's unacceptable for women to say, hey, I want to look great and feel great, but it's okay for guys to do it as well. And so that's why we're talking about topics that maybe not a lot of people know. So my first topic is male enhancement, and it's non-surgical. Who doesn't want to enhance their male genitalia? And we have non-surgical ways to do so, so there's minimal downtime. So what is it? There's a lot of questions about this. So again, it's non-surgical. So you have very, very little downtime. It's basically an in and out outpatient procedure. You're awake. There's no anesthesia or general anesthesia, completely awake. No need to, prepare for anything. And again, no incisions because it's non-surgical. Things that a lot of patients have asked me and are a little bit confused about is it an implant? It is not an implant. It is not a device. It's not anything extra that you are implanting into the penis. It's actually the same thing, fillers, that women use for their lips. And we're just actually putting it in a different area for males. What the filler is hyaluronic acid, which is a natural product that your body makes. And so we have syringes of hyaluronic acid that's synthetic. And so we just use it to help plump up and increase the girth of the penis. So, what are some common questions that I get from my patients? Who is a good candidate for this? Anyone who, wants to enhance the girth of their penis. If it's something that you've ever been interested or curious about, or it's just something that you've been thinking about, anybody is a potential candidate. Does it increase length? This is specifically for girth. However, my patients have actually come back to me and said because, they've noticed actually an increase in their flaccid state because it's heavier, it's girthier, and so when it's flaccid, it actually gets longer. Now, is this permanent? No, it's a hyaluronic filler or acid fillers, just like women when they get their lip injections. It has to be done within a certain amount of time. The filler that we typically use lasts anywhere from 1 to 2 years. However, based on the individual and your metabolism, it can range. And so it should last anywhere from 1 to 2 years, but there is a maintenance, and it is one of those things that, hey, it doesn't last forever, which is also a good thing because it's not permanent. So how long does a typical procedure last? The actual injections of the hyaluronic filler is approximately 30 to 40 minutes, but you want to dedicate about an hour and a half, just because it takes time to prepare you and to numb you to make it as comfortable for you as possible. And this is probably one of the most important questions, is it safe? So in the genital area is extremely important if you have somebody who is a well-trained and skilled plastic surgeon in this process, because there are dangers to it. If you inject it in the wrong place, you're going to cause issues. And so you don't want to just see any injector. You want to see somebody who is experienced, such as a plastic surgeon who knows the anatomy. What are the dangers? If you put any filler in any location, it doesn't matter if it's the genitals or the face, if it gets into a blood vessel, then you can cause what's called skin necrosis or damage to the skin. So that's why we emphasize that something like this, you want to see somebody who is well trained and who has been doing this for a while or has been trained to do this. Another major question that everybody asks is, how big can I get? Well, it's based on the individual. You know, you can keep going with filler, just like the lips. People can keep getting bigger and bigger. However, you want to ask yourself, does it look natural? And so it's kind of a balance between, hey, how big do you want to be? But at the same time, you know, do you want to maintain a natural appearance? And then are there any other benefits? So there's research-wise, we are still learning, but typically or anecdotally from my own patients who have had this procedure done, they've actually reported to me, hey, I've got better sensation. When I do have an erection, it's better and stronger, lasts longer. Guys who did not have morning erections in the past are now starting to have morning erections. And they also have an increased libido, and their partners are saying that they're more satisfied or happier with them. And more importantly, they have improved self-confidence. And so is this because of the filler, or is this because of, you know, just feeling better about yourself? You know, we don't know, but this is kind of a additional benefit that my patients have described to me. So we can move on to our next topic, which is gynecomastia, or male breast reduction or chest surgery. And so male chest surgery, or what we call man boobs, you know, this happens to a lot of people, and you're not stuck with it. This is something that does happen, whether it's based on diet or exercise or anything like that. There's lots of causes. So what is the scientific term of gynecomastia? It's basically any breast tissue enlargement in your chest. So like females, males also have breast tissue. There's fat, but there is breast tissue. So what are the causes? Well, some of it's just hormonal. Sometimes, you know, if we don't have the great diet or exercise, excess fat can cause it. But then other other not well-known causes include marijuana, cancer, and certain drugs that you take. And so a lot of patients will be like, hey, will it just go away? Well, unfortunately, it will not. If you have an excess or growth of breast tissue, that does not go away with diet and exercise. It has to be surgically removed. Now, if it's mostly just primarily fat, then we can do some liposuction, and sometimes diet and exercise does help. But if it's breast tissue, it has to be removed. Otherwise, it's there forever. Other questions that I get. So how do you remove the tissue? Well, it is dependent on how severe your gynecomastia or your excess breast tissue is. So it's dependent on the extent of where and how much breast tissue you have, and whether or not you have excess skin. So if it's just fat, we can remove it with minimal incisions that are barely noticeable, and just do liposuction. You can do this awake or asleep based on your comfort. If it's glandular tissue, if we feel that there's actually glandular tissue, you actually have to make a bigger incision, but it's still not noticeable. It's usually around the areola, which is the colored portion of the nipple, and you have to actually remove it surgically. Now, if it's to the extent where you have extra tissue, that tissue is not going to just shrink down if you remove the fat or the glandular tissue. You actually have to excise that tissue, and so you will have a larger scar. But, you know, when you do something like this, the point of it is to get that contour back and to remove the extra tissue. How long does a procedure take? Well, I would say on average, it's about 3 hours for the actual procedure. But again, that can be longer or shorter based on how much tissue you have or glandular tissue you have. And also another common question I have is, do I have to be asleep for this procedure? And I've done patients who are wanted to stay awake, but it has to be the right candidate. So if surgery freaks you out, it's better for you to stay calm and be comfortable, then asleep is better for you. But, you know, some people want to be awake during the procedure. there. And so depending on how much we have to take out, that is a potential possibility for you. So I'd love to show you some before and afters. So this is one of my patients that he actually elected to do a weight. And so if you see, if you pay attention to the chest, he has this pointy areola, and after surgery now it's a male, more masculine appearing chest. So these are just the right and left. This is 3 months after his procedure with minimal incisions. We have some other before and afters as well. And so this is a 40 to 45-year-old male after 1 year of gynecomastia reduction. And again, you see this enhanced or growth of glandular tissue that has to be excised or removed through liposuction. And again, same thing, some people will be like, hey, this might go away, or are thinking that, hey, with diet and exercise, it'll go away. But unfortunately, it won't. Glandular tissue has to be removed. And now this is an example of a male who actually has a more severe gynecomastia. I mean, this is extra skin. And so in order to remove that skin and get that contour, that flat masculine chest back, we do have to excise the skin. And so you will have this larger scar, which is, it is kind of a balance. If you want that contour, the only way to do that, to get rid of the extra skin, is to cut it out.
Well, thank you, Dr. Lee, for the wonderful presentation. We're going to switch to our non-surgical area weight loss at the Amachi Spa. Our presenter today is MJ, also Majida. She's a statistician, the spa director at Amachi Spa. MJ, you ready?
Yes.
All right.
Hello, everyone. My name is MJ. I'm the spa director down at Amachi Med Spa. Amachi is located on the lower level of Georgia Plastic. We have a beautiful space, so we would love for you to come and see us. We do a lot of the non-surgical treatments, but we also do a weight loss program. So in our weight loss program, we do offer 2 of the GLP-1s. We offer the semaglutide and the tirzepatide. I would say 95% of our patients are on the semaglutide. Semaglutide is a little bit stronger than the tirzepatide, but it just depends on how the patient's how the medication works with the patient's body. So it's very customizable. We have all of our patients before we begin. We have them draw labs. We can either draw labs here or we can order labs for you. And our medical director, Dr. Okoro, he has to approve every patient before we even get started. So you have to make sure the patient is healthy enough to even begin the program. Our program is a 3-month program, or you can do a 6-month program. We do have some patients who may have done a program before in the past, or some patients who are not looking for a massive weight loss and they want to do a month-to-month program. So we have that option as well. Our weight loss program, it is a weekly injection. So you have the option to come in-house and do the injection with us, or we can draw up your medication and you can do your own self-injection at home. You are instructed on how to do that when you come in for your consultation or when you come in for your medication pickup. We also do our GLP-1s with vitamin B12. Vitamin B12 helps combat a lot of those side effects that patients may feel. Some of the side effects that we hear is nausea, some migraine, some fatigue, slight constipation. But as long as the patient is following a healthy diet and exercise routine, usually they don't experience that. I don't really have any patients that come and that complain about these side effects severely. In addition to our weight loss program, if you are interested in doing some fat reduction, we also do cool sculpting. Cool sculpting is different from weight loss. So when patients come in and they want a consultation for fat reduction, we talk about everything. We give them options on weight loss. Weight loss, of course, is a full total body transformation. Cool sculpting is more kind of localized. And for example, these are some cool sculpting panels. So when a patient comes in for cool sculpting, I ask them what area they're interested in, and then we measure the area. So we can literally put these panels anywhere. Panels are available for the arms, for the legs. Cool sculpting is FDA approved to treat every area of the body. So if patients just have some localized areas, they may be a candidate for cool sculpting. If patients are interested in doing a full body transformation, then we will steer them more so towards the weight loss program. Cool sculpting does kill about 35% of fat Every time you have the treatment, it's non-surgical, no downtime. Patients come in and they have cool sculpting done on their lunch break, go back to work. It's a very comfortable procedure. The way it works is fat cells that can only survive under regular body temperature. So if your body gets too hot or too cold, the fat cells start to die. And it's more comfortable to get the body to be too cold, because if you can imagine trying to heat up the tissue, it can be very uncomfortable. But when we cool everything down, it just goes numb. So patients come in, they're very comfortable, they take a nap where they're getting their cool sculpting done. It takes about 90 days to see the full result from cool sculpting, but about 2 weeks after your first session, you will start to notice a reduction in fat. We also, in addition to cool sculpting, we also have M-Sculpt. M-Sculpt, we have both devices. We have an M-Sculpt original device, and we also have an M-Sculpt Neo. The difference between the two is that they both treat muscle, they both build muscle. However, the M-Sculpt Neo also kills fat. The M-Sculpt Neo can kill as much fat as cool sculpting can kill, so about 35%. It's just that cool sculpting is FDA approved for more areas than the M-Sculpt is, because the M-Sculpt has electromagnetic current, so that current is not safe to be placed all over the body. So patients would come in, sometimes patients would do a double treatment. They'll do cool sculpting and M-Sculpt. So if you have a little bit more fluff in front of your muscles, you'll want to do the cool sculpting first to reduce that fat, and then we can do the M-Sculpt to really bring out those muscles. M-Sculpt is FDA approved for the abdomen, for the arms, the thighs, and we were actually part of the study to get M-Sculpt approved for the flanks.
Thank you, MJ, for that wonderful presentation. So now I'm going to talk about hair restoration. A lot of men struggle with hair loss. It also happens in women, but today is for him, not for her. Yes. So we do offer both surgical and non-surgical hair restoration solutions. Some of the ones that we do, we do have light therapy, we have PRP, we have growth factors, we have microneedling. All of this stuff can help restore or nourish the hair that you already have. But once the hair is gone, like it's gone. It's not coming back. If the hair is dead, the hair follicle is dead and it's gone, it's gone. No matter what you do, it will not come back. So the only way to put a hair where there's no hair is to do a hair transplantation. So it's called hair transplant. We've done a lot of research and we chose smart graft. Smart graft is the latest minimally invasive for follicular unit explantation technology. It gives natural looking hairline restoration. There's no linear scar. It has fast recovery. This is how we do it. We combine PRP, we remove the hair individually so there's no cut. These are some of our before and after photo. Depending on how much hair we are restoring, it could take up to 4 to 8 hours, depending on what we do. Why do smart graft? Because you don't want this. This is a straight method. A straight method leaves you with a scar. With a smart graft, the hair is taken out individually. There's no scalpel involved, no sutures, no linear scar. Everything is numbed up. There's no downtime. Just walk the next day or so. There's no large areas of single session. We can do up to 2,000 grafts in one session, in one sitting. It reduces the need for additional procedure. When you compare smart graft to the traditional hair, you could see in this case, the strip is taken, it leaves you with a bad, ugly scar. This is how it looks immediately when we're done. The area is shaved. For men, for women, we shave a little strip. If they have long hair, it can cover it up as well. Within a few days, the hair grows, there's no scar. This is essentially the progression before day 1, day 5, day 8. You can see the hair grows. So we don't take out all the hair. We take out enough hair, up to 45% of the hair in the area where you will not go bald. Once all that hair is removed, we put it individually on the area where we need to put the hair in. So that's why we like Smart Graph. Now let's talk about how to pay for all of this stuff, how to pay for your confidence. Who's the Nayeli is going to talk to us about how to pay for it. You ready, Nayeli?
I am ready. Let's talk about financing. My name is Nayeli. I'm a patient care coordinator here at Georgia Plastic. This is where I specialize in the office. We do have three amazing financing options. Care Credit and Alpheon are the first two we started working with. We recently added Cherry. They are very, very similar to Care Credit and Alpheon. They work all the same, up to 24 months interest free for our patients. Care Credit and Alpheon, like I said, are the first two that we did start our office with. This is a graph and a chart that shows you the payments that we offer and the interest-free rates that we offer with Care Credit and Alpheon. They work very, very similar. This chart is for Alpheon patients. Our interest rates with Care Credit are just a little bit different. So if you have any particular question in regards to Care Credit and your chart or their financing options, definitely reach out to me personally and I can tell you what those payments are like. Cherry works very similar, like I said, to Care Credit and Alpheon. They do have a deferred interest for some patients as well, but it does depend on the qualifying patient and what interest rates they can give you. Today's promotions. Now we do have some promotions going on today for our event, for our mail event. Usually our 6 sessions for Apex, which is in a series, like I said, of 6. It's typically about $4,000. Today, just for today only, it's $3,000. Our cool sculpting, very, very cool for a fat, just like Majida was talking about. We have the 15% off for 4 panels or more. Typical price range is about $2,000 to $6,000. Only today, $2,500 to about $5,100. We have our very popular 3-month weight loss program with the semaglutide, tirzepatide, and today only with the labs included. Am I wrong, Dr. Okoro? It'll be $1,275. Is that with the labs included?
I don't know. You have to ask.
We will ask Majida just to confirm, but we do draw everyone's labs prior to starting on your program, and we do want to make sure you're good and healthy and safe before we get you started. So give us a call today. Our Botox is 15% off. That special we have only once a year. Our men are lucky because they do get it twice this year. So 15% off, typically $300 per area. So definitely give us a call and take on that promotion. And then all our other spa treatments are 15% off for our male patients, Georgia Plastic procedures as well for our patients. Some of them are going to be for 15% off. You're probably asking yourself, how am I going to secure this discount if you guys are closed today? Don't worry about it. Send in your deposit of $250 so that we can get you scheduled for that evaluation with either Miss Sarah, Dr. Okoro, or Dr. Lee so that we can get you scheduled for one of your treatments today. Follow this video right here. Go onto our website, www.georgiaplastic.com. Go to make a payment. Scroll down. It's going to take you to a little screen menu that's going to have like other payments. You're going to select the $250 payment. You're going to put in special promotion. You're going to probably put in men's wellness so that we know to call you on Monday so that we can lock you in for that consultation. So how can you book your consultation? You're going to call us on Monday or you're going to submit that inquiry through our website over the weekend. You're going to call Machi Med Spa. Our Machi Med Spa is open until 12 p.m. today. So you don't want to miss it. If you want to lock in that promotion today, our Machi Med Spa will be open. Or you can also go on their website, www.amachimedspa.com, and book in that inquiry. So why should you choose us? One, simply because we're the best. And then 2, we have won many, many awards. We did win Best Med Spa for Men in 2024.
Thank you very much, Nayel. At this point, we're going to open it up for any questions. If anybody have any questions, this is the time to ask it. We are here to answer every question. So right now, we are going to just open up. Everybody's muted, so you can unmute yourself, ask a question, or you can type your question on the chat. The chat is open. We'll be here to answer any question you have about anything that you heard today or any other topic for that matter. So, Dr. Lee, are you ready to answer questions, right?
Yeah, I'm happy to answer any questions.
All right, let's see if we'll unmute everyone. So if anyone has any questions, feel free to unmute yourself. We're here to answer all your questions.
I do have one question for Dr. Lee.
Go
Yeah.
ahead.
Dr. Lee, how soon after their first girth injection would a maintenance be needed?
So it is actually dependent on the individual. Um, and
Okay.
so and so oftentimes, and I will tell you this with every single patient, some patients, just like with the lips, they love that initial swollen appearance. And so they'll come back to me after they're done swelling. They'll be like, I love that the girth that I got, but I like that initial appearance first. So they'll ask for more. And so that's completely acceptable. It's okay to do that because, I'd love to be conservative and keep everything natural rather than going overboard the first time. But typically I would say, after about a year, then it kind of 6 months is after, so a year to 6 months is typically when people will be like, hey, I love it. I kind of want more. Or they'll start to notice that, like, especially if they have high metabolism, they'll be like, hey, I'm starting to see it kind of go down a little bit. Then we can go ahead and add a little more. Again, it's based on the individual and what they want.
Perfect. Thank you.
You're welcome.
Thank you. Okay, any other questions? If you don't have any questions or want to, I know this is a very private matter. Sometimes people are shy. That's why we want to have this event virtually because a lot of men don't like to come to the office. So we kind of make it very, very private. So if you want to have your own private session, feel free to give us a call in the office to schedule your confidential consultation. We offer both virtual and in-person consultation on any of the topics that you heard today. I don't see any questions on the chat, and I think that's good. All right. Well, everyone, thank you for joining us on this virtual men's event at the Aegis Men's Center, sponsored by Amachi Med Spa and Georgia Plastic. We look forward to hearing more from you guys. This event is being recorded. We're going to post it on our YouTube page, Instagram, TikTok, and everywhere else our patients are. Without further ado, I would like to say have a wonderful weekend.
Bye.
Bye.